there seems to be this opportunity where Big Pharma appears to be making profit. Am I wrong on this?
You're not wrong. Clearly, COVID is a global pandemic, so it's led to a big increase in many areas of healthcare. So as you mentioned, PPE, vaccines, face masks. So it has become a big business, and that's understandable because of the scale of the pandemic globally, with so many people infected around the world, including in the UK.
So there seems to be a lot of... And what about the whole vaccine scenario? Because I'm thinking, surely they can come up with, they've got a lot of money been given. These companies have been given quite a fair amount of money to create the vaccine in the first instance. Absolutely, totally understandable and fair enough, right? But I'm feeling this booster thing and the repetition of it all. Surely we could spend some more time actually developing a vaccine that would stop you from catching it in the first place.
Many vaccines do require multiple doses. So for example, hepatitis B requires 3 doses. Diphtheria and whooping cough require 3 doses, followed by boosters. So it's not common for vaccines to require 3 or more doses. So I think it's quite understandable that these vaccines do require multiple doses to generate a good immune response. Each vaccine you're given increases your protection. So 1 dose gives some protection, 2 improves that protection, and 3 increases your protection again. So I think it's quite natural and normal to expect vaccines to require 3 or more doses. It's very common for other vaccines, and we're seeing the same thing now with vaccines for COVID-19.
But it's over quite a short space of time now. So my next booster, I've had my booster jab. I'm all for the vaccine. I'm glad that it's saving lives, and I believe they're life-saving. But every 6 months, there's a booster now, and can they not make the vaccine last longer then? Because some of them, for example, the meningitis jab that you have when you're young, you have that over a period of time, but then it lasts for a very long time. Why can they not investigate that?
The protection will vary from vaccine to vaccine. So, for example, the flu vaccine, there are quite only boosters because the virus mutates so much year to year. With these vaccines, they are quite new, so we don't fully understand the long-term protection they provide. But we do know that 3 doses provides very good protection. Maybe that 3 doses is enough, but that will take time to understand. So in the coming months, we'll monitor people who've been vaccinated and look at their infection rates, and that will guide us as to whether we need to give further booster doses in the future. But so far, we do know that 3 doses works very well. So if you are due a booster dose, then please get that booster dose now rather than waiting for it.
So how do you think, in your eyes, COVID has changed the whole sort of healthcare industry?
It's quite clear, it's a big impact, as you mentioned, on society. So many people have fallen ill and many have died. It's affected people's education. It's affected many parts of the economy. So hospitality, travel, are all badly affected. Unfortunately, until we have vaccines globally with probably 3 or more doses, it's going to be a problem for some time to come. So this will be a big business, I think, for many more years to come. And it will be have a big impact on public health globally. But I would hope with 3 vaccines, we will start to slowly bring it down in the UK. Longer term, we don't know how many vaccines we'll need, but we do know that 3 vaccines work very well. So I'm quite hopeful that by the spring, we can really suppress the severity of the disease in the UK at least.
Interesting. I don't know whether I can squeeze in one more question, but I've got to go. Thank you so much for that. I did want to ask...
Thank you very much, Anna.
Very, very briefly, though. If Omicron doesn't turn out to be as potent in terms of its deadly effects as the previous version, so the Delta variant, is it better for it to sort of overtake this variant?
If it is a milder infection, it's better in some way if it overtakes other viruses. But at this stage, we don't fully understand its impact in the UK. UK's got a quite little population, lots of chronic problems like diabetes and heart disease. So we don't fully understand how people with those problems will be affected by the virus. So that, again, will take some time to understand fully.